Hello, everyone. This is Dr. Joe Congas with Whole Child Pediatrics. I just wanted to come on here today and have a little chat with our new nurse practitioner, Beth. She joined the team a few weeks ago and is now on her own, working hard. She comes to us with a lot of great experience. For those who know me, know that I took quite a long time, went through a lot of applications and then a lot of interviews to find who I felt was a perfect fit for our practice. And I think we've done just that. So I want to let you guys get a chance to get to know her a little bit. And so I'm just going to kind of let her start talking about like where she's from, where she went to school, anything she thinks we ought to know about her, and then we'll ask some other questions as well. So Beth, the floor is yours.
Well, hello, everyone. I can't wait to meet you in office. To start, I was born in northern Indiana, but didn't live there very long. I lived in southern Illinois for quite a time. So, yes, I am a Cardinals fan. I know that is key. Um, I then moved in elementary school to South Carolina, and that is where I completed high school. And I went to the University of South Carolina for my undergraduate degree in biology. After that, I really was looking for my next step, whether I wanted to do medical school, nurse practitioner school, and I really found that Vanderbilt in Nashville, their nurse practitioner program, to be a perfect fit. So my husband and I lived in Nashville for the last 5 or so years as I did my nurse practitioner got my license, finished that degree, and then worked for 2.5 years in a small practice in Tennessee. My husband and I moved here to St. Louis during the pandemic with a 2.5-month-old in September, and we were just looking for the right spot for me to start practicing again. And I feel like Whole Child is definitely that perfect place for me to continue working with your little ones and your big kids and kind of working with your family as we establish great habits for them to carry on into adulthood.
I tell you, we started you with some, little hours because you have a little one at home and want to be able to expand those. But as you have seen, we're growing kind of rapidly right now. And so those hours have expanded some.
Yes.
I really appreciate you stepping in and really taking good care of our families. So a little bit about Whole Child for those who don't know and those that are current patients. We try to do things a little more natural. My favorite tagline for myself is basically, I'm not holistic. I just think kids get too much medicine. I might work on a better one, but that's what I have for now. But it really just comes down to that lifestyle modification, things like that before medication when at all possible. And can you talk a little bit about your experience or, what you think you bring to Whole Child and to the families that you can help them with? And like you said, we're always here to learn from them as well. But what kind of experiences you have working with families in a more natural like environment and yeah, go from there.
Absolutely. I personally have been on a journey of trying to kind of purify more of my habits. And so seeing how that has changed in my personal life and wanting to establish those habits with my daughter Finley, I really think that that philosophy of really figuring out your environment and what the body is taking in every day and how that affects us on just even the most basic level is key. And we can easily just throw medicine at something and it might help on the surface, but not fix that key issue underneath if we're just seeing a symptom. So I do think working with families, figuring out what works best for each individual family, because what works for me might not work for your child or for your family, but working as a team to figure out how we can create the best environment for your child and then moving forward to medication as needed. Of course, there are illnesses and things that require medication and treatment right away, but a lot of what we take in on a daily basis is not exactly helping us to fulfill our and reach our optimal wellness. And so I've watched as I've started working, I worked in a rural practice and just trying to figure out what we can do and be creative with our resources and what we have in order to produce what's best for each individual family. And so that doesn't mean you need to have a ton of money or have a lot of access to specific technology or anything like that to reach wellness. Every person can reach that specific goal with what they have around them, and just kind of reaching for that goal together.
No kidding. I think, kind of on that note, we shop at Aldi. There's a lot of good foods and healthy foods you get at Aldi. There's a lot of unhealthy foods you can get at Aldi, but you can get a lot of healthy foods there. So you don't have to go to Whole Foods to eat healthy or fresh time. Those are great options if you can afford them and you like them, but not things you have to do. And then you hit the nail on the head with what I do for my family doesn't always work for your family. I think that we as pediatricians and probably nurse practitioners sometimes get stuck in that rut of the AAP said so. I've had pediatricians tell me that for my own kids. Sometimes kids just don't follow the books and things just don't fit for a family. I think guideline is a good term, and what we do is we educate and we give our medical opinions, and then families have to take that information and use it to what they think fits their family the best. And working hand in hand to figure out how we can help them in that journey is just so key. So awesome to have you aboard. Let's see here. I think one of the other things that I wanted to bring up was lactation counseling, help with breastfeeding support. That's one thing I've always gotten a lot of questions for, and I've always had to refer out to. And I noticed that when you were shadowing me, that you had a lot of good answers for families. And maybe you're not a lactation consultant, but can you tell people like what, I guess, how you feel about breastfeeding and what kind of experience you have in helping parents with breastfeeding? And obviously, you've probably had some challenges in your own life with breastfeeding.
Yes. First of all, I just want to say that fed is best. And so how you feed your child is what's best for that child. We want to give them the best nutrition possible. But breastfeeding is wonderful. It's a great experience if you get to have that with your child, a fun bonding experience, but it comes with a lot of stress a lot of times for parents. And so whenever I was pregnant with my child, I did a lot of research trying to figure out how to best set us up after coming home from the hospital and reaching that breastfeeding journey. And so I'm continuing to learn. I follow a couple of lactation consultants on Instagram, and I'm reading a lot of new information, just trying to build that knowledge base so that I can better help our families. We can kind of work on some holds, work on some latch in the office if we're having trouble in those first couple of weeks. Just learning about those cues of knowing, well, how do I know if baby's getting enough? How do I know if we are latching correctly? And so those are kind of key supports. Now I might have to say, hey, lactation consulting might be the next step for you if we're having a really difficult scenario, but I definitely feel confident in kind of helping moms on that journey. I didn't get to continue breastfeeding with Finley. My milk just never came in, and just knowing that comfort too, if you're experiencing that as well, it's normal. It can happen. So we can kind of go back and forth, talk about your concerns, just build your confidence in that area. And if I feel like we need to reach out to other resources, there are a ton of great resources in St. Louis that I've already kind of looked into. So anything that you have questions about, I'm totally open to helping with and kind of growing in that area as well.
Perfect. Well, I don't think I have any more questions up front. Is there anything else you think people should know, or you think that's a good start? I think it is too.
I think it's great. We're enjoying what St. Louis has to offer, and I have really enjoyed getting to know some of the families that I've gotten to meet so far. And Mandy, our medical assistant, and I think we're going to make a great team and just have a lot of fun with our families as we see them grow.
Awesome. Well, again, thanks for coming on today to chat with me so we can get you introduced to all of our families at Whole Child Pediatrics, and welcome aboard.
Awesome. Thank you. So happy to be here.